Hey students, this is part 3 of the chapter Forearm and Hand. Let's get started. Fibrous flexor sheets of the fingers. The fibrous flexor sheets are made up of the deep fascia of the fingers. The fascia is thick and arched. It is attached to the sides of the phalanges and across the base of the distal phalanx. Proximally, it is continuous with the slip of the palmar aponeurosis. In this way, a blind osseofacial tunnel is formed which contains the long flexor tendons enclosed in the digital synovial sheath, figures 9.17a to c. The fibrous sheath is thick opposite the phalanges and thin opposite the joints to permit flexion. Intrinsic muscles of hand. Features. The intrinsic muscles of the hand serve the function of adjusting the hand during gripping and also for carrying out fine skilled movements. Their attachments, nerve supply, and actions are given in tables 9.5 and 9.6. There are 20 muscles in the hand. These are number 1, 3 muscles of thenar eminence, abductor pollicis brevis, figure 9.19, flexor pollicis brevis, and opponens pollicis. 1 adductor of thumb, which is adductor pollicis. Number 2, 4 hypothenar muscles, palmaris brevis, abductor digiti minimi, flexor digiti minimi, opponens digiti minimi. Muscles 2nd to 4th are muscles of hypothenar eminence. Number 3, 4 lumbricals, figure 9.21. Number 4, 4 palmar interossei, figures 9.23, 9.24b and c. Number 5, 4 dorsal interossei, figures 9.23, 9.24a and c. These muscles are described in tables 9.5 and 9.6. Actions of thenar muscles. In studying the actions of the thenar muscles, it must be remembered that the movements of the thumb take place in planes at right angles to those of the other digits because the thumb first metacarpal is rotated medially through 90 degree. Flexion and extension of the thumb take place in the plane of the palm, while abduction and adduction at right angles to the plane of palm. Movement of the thumb across the palm to touch the other digits is known as opposition. This movement is a combination of flexion and medial rotation. Actions of dorsal interossei. All dorsal interossei cause abduction of the digits away from the line of the middle finger. This movement occurs in the plane of palm, figure 9.25, in contrast to the movement of thumb, where abduction occurs at right angles to the plane of palm, figure 9.26. Note that movement of the middle finger to either medial or lateral side constitutes abduction. Also note that the first and fifth digits do not require dorsal interossei as they have their own abductors. Testing of some intrinsic muscles. A part. Pen or pencil test for abductor pollicis brevis. Lay the hand flat on a table with the palm directed upwards. The patient is unable to touch with his thumb a pen or pencil held in front of the palm, figure 9.27. B. Test for opponens pollicis. Request the patient to touch the proximal phalanx of the second to fifth digits with the tip of the thumb. Now table 9.5, and it gives us attachments of small muscles of the hand. So we have name, then origin, and then insertion. So first is muscles of thenar eminence, abductor pollicis brevis, figure 9.20, origin, tubercle of scaphoid, crest of trapezium, flexor retinaculum, insertion, base of proximal phalanx of thumb. Flexor pollicis brevis, origin, flexor retinaculum, crest of trapezium, and capitate bones. Insertion, base of proximal phalanx of thumb. Opponent's pollicis, figure 9.22. Origin: flexor retinaculum, crest of trapezium. Insertion: lateral half of palmar surface of the shaft of metacarpal bone of thumb. Adductor of thumb, which is adductor pollicis. Origin is oblique head from bases of second to third metacarpals and the transverse head from shaft of third metacarpal. Insertion is base of proximal phalanx of thumb on its medial aspect. Muscle of medial side of palm, which is palmaris brevis. Origin is from flexor retinaculum and insertion is skin of palm on medial side. Muscles of hypothenar eminence. Abductor digiti minimi. Origin is pisiform bone and the insertion is base of proximal phalanx of little finger. Next is flexor digiti minimi. Origin is from flexor retinaculum and insertion is base of proximal phalanx of little finger. Number 3 is opponent's digiti minimi. Origin is from flexor retinaculum and insertion is at medial border of fifth metacarpal bone. Next is your lumbricals, figure 9.21. Lumbricals, they are 4 in number and they arise from 4 tendons of flexor digitorum profundus. Origin: the first one, from lateral side of tendon of flexor digitorum profundus of second digit. The second one, from lateral side of the same tendon of third digit. Third one, adjacent sides of same tendons of third and fourth digits. And the fourth one, adjacent sides of same tendons of the fourth and fifth digits. And the insertion is via extensor expansion into dorsum of bases of distal phalanges. Okay, the next is palmar interossei, and there we have 4 palmar muscles, figures 9.24b and c. Origin: the first one arises from medial side of base of first metacarpal, the second, third and the fourth. The second one originates from medial side of shaft of second metacarpal, the third one from lateral side of shaft of fourth metacarpal, the fourth one lateral side of shaft of fifth metacarpal. Insertion: the first one is via medial side of base of proximal phalanx of thumb or first digit, and the rest of the 3 via extensor expansion into dorsum of bases of distal phalanges of second, fourth and fifth digits. Figure 9.53. Dorsal interossei. Dorsal, they are 4 in number, figures 9.24a and c. First, originates from adjacent sides of shaft of first and second metacarpal. Second one, adjacent side of shafts of second and third metacarpal. Third one, adjacent sides of shafts of third and fourth metacarpal. And the fourth one, adjacent sides of shafts of fourth and fifth metacarpal. And the insertion is via extensor expansion into dorsum of bases of distal phalanges of second, third and fourth digits. Table 9.6, nerve supply and actions of small muscles of the hand. Muscles of thenar eminence. Abductor pollicis brevis, figure 9.20. Nerve supply is median nerve. Actions are abduction of thumb. Flexor pollicis brevis, nerve supply is median nerve and the actions are flexus metacarpophalangeal joint of thumb. Opponent's pollicis, figure 9.22. The nerve supply is median nerve and the action is it pulls thumb medially and forward across palm, opposite thumb towards the fingers. Adductor pollicis, it is supplied by deep branch of ulnar nerve which ends in this muscle. Action: adduction of thumb. Palmaris brevis, it is supplied by superficial branch of ulnar nerve. Actions: it wrinkles skin to improve grip of palm. Muscles of hypothenar eminence. Abductor digiti minimi. Nerve supply is from deep branch of ulnar nerve. It abducts little finger. Flexor digiti minimi. It is supplied by deep branch of ulnar nerve and it flexes little finger. Opponents digiti minimi. The nerve supply is from deep branch of ulnar nerve. Actions pulls fifth metacarpal forward as in cupping the palm. Lumbricals, figure 9.21. Lumbricals, first and second, that is lateral 2 by median nerve, and the third and fourth by deep branch of ulnar nerve. Actions, they flex metacarpophalangeal joints, extend interphalangeal joints of second to fifth digits. Palmar interossei, figure 9.24b. Deep branch of ulnar nerve is the nerve supply. Palmar interossei adduct fingers towards center of third or middle finger. Dorsal interossei, dorsal figures 9.23 and 9.24a and c. Nerve supply is from deep branch of ulnar nerve and actions are dorsal interossei abduct fingers from center of third digit. Both palmar and dorsal interossei flex the metacarpophalangeal joints and extend the interphalangeal joints. The dorsal interossei are tested by asking the subject to spread out the fingers against resistance. As index finger is abducted, one feels first dorsal interosseous, figure 9.28. D part. The palmar interossei and adductor pollices are tested by placing a piece of paper between the fingers, figure 9.29, between thumb and index finger, and seeing how firmly it can be held, figure 9.30. E part. Froment sign or the book test, which tests the adductor pollicis muscle. When the patient is asked to grasp a book firmly between the thumbs and other fingers of both the hands, the terminal phalanx of the thumb on the paralyzed side becomes flexed at the interphalangeal joint by the flexor pollicis longus, which is supplied by the median nerve, figure 9.31. If the lumbricals and interossei are tested by asking the subject to flex the fingers at the metacarpophalangeal joints against resistance. Dissection. Clean the thenar and hypothenar muscles. Carefully preserve the median nerve and the superficial and deep branches of ulnar nerve which supply these muscles. Abductor pollicis brevis is the lateral muscle. Flexor pollicis brevis is the medial one. Both these form the superficial lamina. The deeper lamina is constituted by opponens pollicis, figures 9.19 to 9.22. Cut through the abductor pollicis brevis and flexor pollicis brevis to expose the opponens pollicis. These three muscles constitute the muscles of thenar eminence. Incise flexor pollicis brevis in its center and reflect its two parts. This will reveal the tendon of flexor pollicis longus and adductor pollicis on a deeper plane. The three muscles of thenar eminence are supplied by thick recurrent branch of median nerve, figures 9.20 and 9.22. On the medial side of hand, identify thin palmaris brevis muscle in the superficial fascia. It receives a twig from the superficial branch of ulnar nerve. Hypothenar eminence is comprised by abductor digiti minimi medially, flexor digiti minimi just lateral to it. Deep to both these lies opponens digiti minimi. Identify these three muscles and trace their nerve supply from deep branch of ulnar nerve. Between the two eminences of the palm, deep to palmar aponeurosis, identify the superficial palmar arch formed mainly by superficial branch of ulnar and superficial palmar branch of radial artery. Identify its common and proper digital branches. Clean, dissect and preserve the branches of the median nerve and superficial division of the ulnar nerve in the palm lying between the superficial palmar arch and long flexor tendons, figure 9.20. Lying on a deep planar or the tendons of flexor digitorum superficialis muscle, dissect the peculiar mode of its insertion in relation to that of tendon of flexor digitorum profundus, figure 9.21. Cut through the tendons of flexor digitorum superficialis, 5 cm above the wrist. Divide both ends of superficial palmar arch. Reflect them distally towards the metacarpophalangeal joints. Identify 4 tendons of flexor digitorum profundus diverging in the palm with 4 delicate muscles, the lumbricals arising from them. Dissect the nerve supplied to these lumbricals. The first and second are supplied from median and the third and fourth from the deep branch of ulnar nerve. Figure 9.21. Divide the flexor digitorum profundus 5 cm above the wrist and reflect it towards the metacarpophalangeal joints. Trace one of its tendons to its insertion into the base of distal phalanx of one finger.